I think that there's a place for these things. This is not for everyone.
No.
This is definitely, obviously, I mean, you don't do any of this stuff and you're perfectly happy.
Yes.
I would not be happy if I didn't have these options, you know? I think,
but you don't know that you wouldn't be happy if you had done nothing.
I know. No, I know I wouldn't be. I mean, as soon as I started seeing the first signs, I was like, I need Botox. So I know that I wasn't happy.
Hey, everybody, I'm Marisha Weiss.
And I'm Jen Giamo.
And welcome to another episode of Everybody Talks, the podcast where we explore the wide world of wellness. Sometimes we talk to experts, sometimes we just talk to each other, but we're always talking to you.
Every week, we discuss topics from nutrition and exercise to mindfulness and self-care. And today we are talking to a plastic surgeon. He's double board certified facial and reconstructive surgeon based in New York City, specializing in procedures of the face, head, and neck.
He completed his undergraduate and medical education at the City College of New York and Stony Brook University School of Medicine. His residency in head and neck surgery at the New York Eye and Ear Infirmary at Mount Sinai was followed by a fellowship on the other coast in facial plastic and reconstructive surgery at USC and the Lasky Clinic in Beverly Hills.
His practice is now here in New York City on the Upper East Side and focuses on a range of facial procedures, including rhinoplasty, notably his proprietary top stitch rhinoplasty, facelifts, blepharoplasty, brow lifts, chin augmentation, and non-surgical treatments like Botox and fillers. Please welcome Dr. Michael Bassiri-Tehrani.
All right. Thank you so much for having me.
Do I call you Michael? Dr.
You
Bassiri?
can call me Dr. Bassiri, Dr.
Okay.
B, whatever you like.
All right.
Yeah, it's
Awesome.
definitely a long last name, and you got through the credentials really well. Thank you.
Thank you. I
You're
tried
very
to
welcome.
there's the what is the term for head and neck?
So it's actually interesting. It's otolaryngology, head and neck surgery. So people know it as ear, nose, and throat, but what a lot of people don't know is ear, nose, and throat doctors go through a whole 5-year surgical training of head and neck surgery. So we are doing a lot of like the thyroid, parotid cancer surgeries, reconstructive surgeries. So it's a lot more than just ear, nose, and throat. But you know, otolaryngology is the correct way of saying part of that. Yeah.
I left that word out because I knew Lori was going to have trouble saying
no
it.
way I was going to be able to
It took me
say
a while
that.
to learn how to spell it. So there's that.
Laryngology. Okay. All right.
Well, let's start with like a little bit about yourself, and which I think we've just gone through a little bit, and how you got into this line. I mean, more plastic surgery type things than.
Yeah, totally. So, I mean, I grew up in New York. I did my training mainly in New York, and I did some fellowship training in Los Angeles. So I got to see both sides of things, both coasts. The training that I did, like I said, is ENT, head and neck surgery. So there was a lot of pretty much anything that needs to be done in the head and neck area, aside from spine surgery or brain surgery. But we work with a lot of the doctors in those areas too to help them access parts of the body that are difficult to reach, so to speak. And then from there, I always enjoyed the reconstructive stuff. I enjoyed the challenges of making things look normal again, and also enhancing the cosmetics, and they kind of go hand in hand. So now mainly my practice, it's a little bit of both. I do some reconstructive like facial fracture stuff through the hospital, but mainly my practice is focused on cosmetic, and so cosmetic surgeries and some non-invasive procedures as well.
Yeah.
Wow.
And we came to see
Yes, we came
you,
to see you
and
in person.
I got a little something done.
Not
and
shockingly, I had nothing done.
Very
but
happy.
Yes.
With that. But I want to talk about cosmetic procedures, and if you could kind of tell us what are some of the trending cosmetic procedures right now and what makes them popular.
I think there's recently been, so everything I say, of course, is coming from like the lens of what I see in my practice as a surgeon. So if you ask, a dermatologist, they may have a different kind of viewpoint or skew on what's popular and not. I think surgically, what we're seeing a lot more of lately is facelift surgery, and facelift surgery happening at even younger and younger ages. And I think that there's a couple of reasons that we're noticing this now. One is there's kind of like this disenchantment with fillers and overfilling your face, and more of an acceptance on doing something that may be more invasive on the front end, but actually having like a more natural result, such as like if your face is losing volume and losing support and sagging, sometimes lifting up and repositioning the fat and the skin and everything back with the facelift can look more natural than just constantly putting fillers and lasers and energy-based devices till the end of time. So we're noticing that more people are getting it. There's definitely been a lot of improvements in the way facelift surgery has been being done, and also with the weight loss medications like Ozempic, a lot of people are losing weight, and they're losing weight fast, and it takes usually about 20 pounds of weight loss before you start noticing kind of volume loss in the face. So with these medications, there is significant weight loss, and we are noticing that people need that skin kind of addressed. So definitely some of that. On the non-invasive side, I think there's a lot of kind of less reliance on fillers and more of a focus on things that are more biostimulatory or from your own body. So one thing that is being used more and more now is PRP or PR. There's something called PRF gel, and there's other mixtures of basically products that come from your blood. So you have some blood drawn, you spin out the plasma layer, which has all the nutrients, and it's separate from the red blood cells, and that gets processed and can be turned into kind of a gel that's used to keep the skin looking healthy, or in some cases, if it's treated into a gel, can actually be used as like a mild filler. And so people like the idea of having something that's from their own body, not from a bottle or a jar or something, and having the potential of the growth factors kind of enhance your own body's natural collagen or healing and glow, essentially.
So with that, with PRP, does it give the same effect as a filler, or is it something that happens gradually over time?
It's a good question. So the PRP itself, so platelet-rich plasma itself, is actually it's like a very thin liquid that isn't really going to do much for volume. It actually works very well if you inject it just under the skin or into the skin with microneedling, to kind of give the skin nutrients that it needs to be healthy, and it can treat maybe some fine lines. It can also be used in like the hairline. So it's used to help stimulate hair growth, not new follicles, but the follicles that have thinner hair in them can actually thicken with repeated PRP use. So there's some benefits there. There are some formulations where you take that PRP or that liquidy kind of gel and you mix it with some albumin that's also from the blood, and that creates like a thicker gel-like substance that can last a little bit longer, but it's not quite as powerful to replace volume as something like filler, the hyaluronic acid filler that you would normally get. Now, it's very soft and it's good for places that maybe underneath the eyes where you don't want anything thick or you don't want anything that's going to stick around a very long time.
Okay. And it could you said it could help to treat fine lines. So like the crepiness under the eyes, would that be something you would use PRP for?
Yeah, you could. I
Ask
mean,
for a
again,
friend.
it's
Asking for a friend.
within reason. I mean, I think with all of these things, it's really important for people to understand like the limitations of what's being done. And there's nothing wrong with doing something that's very, very mild, as long as you know that it's very mild. At some point, the skin around the eyes, or especially the upper eyelid, gets to be so loose that you are almost better off removing that extra skin with surgery. Now, that's something that I am comfortable doing and offering to my patients. But if you go to someone who doesn't offer those procedures, then all they have is these fillers and gels and PRP. They may be recommending it for much longer than it might actually even be useful. And so at least getting the opinion of someone who can do surgery is, I think, useful to help plan out kind of the long term of what you're doing. Because otherwise, you can go down this road of spending time, energy, money on little incremental changes that don't really move the needle that much. And ultimately, you might be open to a surgery, and that might get you a much better result.
Going back to the faceless for a minute, like what is the age that you think someone? I mean, should is a weird word, but what would the age that?
Appropriate age.
Yes, what's the appropriate age to get
Yeah.
a facelift, and what age are you think people are coming in at?
So the numerical cutoffs are very vague, and you can't really base it on that. Everyone's anatomy is very different. Some general kind of rules of thumb: you want to treat what you see. So the face ages in like a certain order. It doesn't just fall randomly, and this all has to do with each individual person's anatomy. So um, internally deep bony structure, bony support is going to be very important for keeping everything projected. As we age, that bone, the bones of our cheek kind of sit back, our eye sockets widen, and that causes fat and soft tissue to basically fall and move into places we don't like. Now, it happens kind of vaguely in this order. Roughly in the 30s, around the eyes, we start losing some support on the lower eyelid, and the fat from the lower eyelid can bulge out, and you get some fat bags from the lower eyelids. Moving on, the cheeks, the malar fat pad over here, the cheek fat pad starts to descend, and you get this kind of nasolabial fold accentuating. And then finally, these guys, the jowls. So right here and under here, that's like the last thing to go. Now, that can be closer to like even like 50s, 60s, 70s. But again, it depends on your bony support. Someone with a very strong chin may go a lot longer before noticing some of this on the jowls. So every patient's different. Some patients, I've done facelifts as young as, the youngest I would say would be like 36. But that was for somebody who almost never really had a neckline to begin with. They just had just a lot of fullness over here. A lot of it was contouring some of the fat that was there and bringing this back. And adding something like a chin implant can actually do a lot if you don't even necessarily want to go for the facelift. Sometimes that can bring the chin out and cause the illusion of a longer jawline without doing anything. So a lower facelift is going to be maybe like late 40s, 50s at the earliest. In general, that's kind of how it goes. There are other types of facelifts, like an endoscope. I do an endoscopic mid facelift, so the cheeks. So as these come down, sometimes in the 40s, I can access them through a small incision up in the scalp and little cameras and engage the cheek and bring this up to recreate like a sharp high cheekbone contour over here. And that's a nice thing to do at potentially a younger age, maybe along with some eyelid surgery, without addressing down here because there may be nothing down there yet.
Yeah. So would you say then for people that are doing or looking to do this at a younger age, is that I don't want to say it's it's preventative. You're still going to age, but
Yeah.
does it help in the long term? Like you wouldn't need other procedures down the road, or does it? You're still aging. Your face is
Very good question. I think that the timing of this is always very important to think about. Number one, you have to be comfortable with the idea of surgery. And if somebody's comfortable with that idea, when do they do it? Now, I've seen it done at like a younger age, like maybe let's call it 50s, for example, when there's some mild changes and you're able to get the lift that you need and it heals, and it's not such a drastic change compared to someone who waits till like 70 to do it when there's a lot more going on. So if you do it younger, the results might be a little less perceptible, a little more subtle, a little more discreet. And the benefit of that also is after you do something like a facelift, essentially, at least the way I do it, I'm getting into the deeper planes of the face and lifting up, and it basically gets set back down and it heals in that position. And that healing, for lack of a better word, it's like an internal scar almost. There's healing that almost glues the face back in the higher position, and it's a little stiffer, less stretchy than it is even before the surgery. So yes, everyone continues to age, but after a facelift, the aging process kind of slows. It slows the progression of it a little bit compared to someone who never had anything done.
Sure.
okay. Okay. And so is it true then? So you talked a little bit about chin augmentation, and so as we age, the chin and the mandible, they both start to recede, right? So is that
Yes.
something? So just talk to us a little bit about what you do with, and again, asking for a friend, what you
If you're
do.
asking for yourself, you have a wonderful chin. I don't think you
I
need
I was
do.
gonna say, it's like you. I mean, look at you. I mean, this is ridiculous.
I feel like I could do. My chin is receding a little bit.
It is not.
So just talk to us about what you would do for that.
Okay, so again, it depends on what the person's baseline starting. So you have a wonderful chin right now, and but it's again, it may have been bigger before, and you may miss that
I
slightly
miss
larger
my
chin.
chin.
So who am I to say if that chin makes you happy? Now, if it's a little bit of a correction, that's pretty easy to do with something like injectable filler. So I would get like a very stiff filler, and I would go right towards the center, right onto the bone. And when you're injecting these products deep onto the bone in the proper way, they're not really moving to other parts of the face. They're not gunking up the lymphatic system, which is more just superficial, kind of just under the skin. So deep injections onto the bone are actually very safe and very nice, I think. And this is one of the most satisfying, easy injections you can have. It just goes right on. It basically brings the chin forward. You watch it happen in real time, and that's really it. If that's something that somebody loves and they don't want to keep doing it every year, then something like a chin implant with there's a firm silicone implant that could be placed just on the chin surgically, that might be a better choice. Even milder than the filler is somebody, and this might not be someone like you who already has like a nice strong chin. People who have weaker jaws just because of their anatomy, something that they do and they might not notice is they have to engage this muscle to close their mouth. So there's a lot of this,
Yeah.
Oh,
like a
that's funny.
sourpuss, kind of bringing the upper lip, actively pushing the upper lip to the lower lip to the upper lip to close the mouth using the mentalis muscle here. And people don't know they're doing it, but oftentimes people who have a shorter mandible will be doing that subconsciously. And what that does is it actually shortens the appearance of the chin. So putting some Botox in there can actually relax that muscle and give you some definition and bring the chin out a few millimeters without even the filler or anything physically sitting in the chin.
That's interesting because so I find myself like I clench all the time. Like I just walk around my day and my jaw is always clenched. And I have to consciously say like, "Oh, relax." So is that something you would do like for the jaw? I guess not necessarily the chin. Would you do
that's also a
Botox?
possibility. So
Okay.
You could put.
things
Could you
like
put Botox there to
so
just?
so this is like Botox and Dysport. These are all neuromodulators. What they do is they go into the muscle and they basically weaken the muscle for about 3 months, maybe a little bit longer, depending on how strong you do it. And so it's a tool. You could put it in any muscle if you wanted to. So yes, in the chin, it'll weaken and relax the lip muscles. In the jaw, yes, you have a very strong muscle here called the masseter. And if you're chewing and it's very strong, putting it into there actually can give you some relief from TMJ pain. Of course, if your bite is off and you have a malocclusion and your teeth have some issues, then that could be the actual underlying cause, but it can give you some relief for sure. At higher doses, the muscle can actually atrophy a little bit and it'll give you a slimming effect. So if someone has a very square shaped face that they want to kind of slim out, then yes, we can put some Botox or Dysport into the masseter and it kind of slims the bottom third of the face.
Do you ever say no to anyone?
Yes,
When
I
they
think
come in?
most of what we do is saying no. And managing expectations and really understanding what people want. I think, especially with like internet hype, people will think that a procedure is going to do something more than it will. And it's my job to kind of explain to them it's probably not worth touching it and you can have more issues. So you really have to be like, have open communication with people.
Yeah.
Yeah, that's a good point. Like with social media, do you get a lot of people coming to you saying like, "Oh, I heard this will work. I want to try this," and they're showing you a picture of someone who's 25 years younger than them. That's what I do.
Yeah, so pictures of someone else. Yeah, we do get a fair amount of that. It's a dangerous game. I mean, yeah, we especially for rhinoplasty, it's very common for people to bring like their inspo page of just other people's faces, and you can't look at someone else's nose in isolation because it fits their face. And so for rhinoplasty, it's very important because you're dealing with someone's complete package. You have to make sure that what you do to their nose matches their face, because you are in a way transforming their face a little bit with a rhinoplasty versus like in a facelift or eyelid surgery, we're more like rejuvenating and bringing it back to like a little more like youthful appearance. But with a rhinoplasty, you could really make somebody look very different if you're not careful. And so, yes, it's interesting. I do like to see what they show me sometimes because, there are certain aspects of the nose that they're like, I don't mind if it's a little in over here. And I'm like, okay, that's actually helpful.
Right. Yeah. Okay. So talk to us then, since we're talking about rhinoplasty, this tip stitch procedure that you do.
Yeah. Oh, okay. Excellent. So tip stitch rhinoplasty is what I call a procedure that I do to minimally invasively lift up the nasal tip. So it's a offshoot of a maneuver I do in all my regular rhinoplasties, but that I've modified over the years to do through minimal incisions and to do awake. And it's very nice to do for people who've lost support, whether it be from prior surgery, from aging, trauma, sometimes even just long-term mask wearing, I think, is stretching out our noses a little bit. So it's done in the office in less than an hour through some small incisions that are not visible. And essentially, I'm using stitches to support the cartilage up to other internal cartilages like I normally would. And it gives you kind of a stabilization of the nose. It kind of prevents it from dipping down when you smile very large, like very strongly. And it has become kind of like very popular in the last few months because of the internet. So since that kind of went viral, I think I am saying no a lot more because it sounds like it's like a very enticing thing. Oh, I can do like just this part of my nose, which bothers me without really any of the downtime. But at the same time, they might have like different expectations of what that'll get them. And they're hoping that this is going to be like the fix for everything without having to do a surgery. So oftentimes proper surgery is going to be the best option.
And the flip side would be too, if somebody came in and wanted a rhinoplasty, but you would suggest maybe they don't need that and they just need the tip stitch.
Yeah, which is true. I mean, I think about like 40% of the people we're doing this on had some prior surgery. And I think a very common problem with rhinoplasty or even septoplasty, like breathing surgery, I knew this from the ENT side, the incisions we make to access the nose can weaken tip support. So the nose can become squishy and it might not be noticeable at first, but 5 years, 10 years down the line, you can lose some support and the nose starts drooping. And nobody likes a droopy nose, regardless of sex or anything or the size. I mean, between size and having a hooked nose, people would much rather have a bigger nose that's not hooked. And that's true for like men, women. So once the natural support gets severed, if you don't do anything to actively rebuild it, so either put cartilage or support it up with stitches, you're running the risk of losing support over time. So I started to do it in my own surgeries. I started adding and doing this this tip stitch essentially in some of my patients whose noses had dropped over time, and it was like a pretty useful technique that now I think is useful for people who may not want to change anything else about their nose, who are busy and professionals and are not really bothered, but they just want like a little bit of an enhancement, and they move on with their lives without much like interference.
Right.
They can't have the downtime or whatever.
And
the
the taboo
is.
of it too. I mean, let's face it, everyone's a lot more open about their procedures now, I found, but at the same time, you don't have to be, and you might not want to be. I find that younger patients now, this is actually very fascinating. They're way more open about the fact that they're having something done, but they also want much less done. Like they want a much more subtle result, but they're much more open about it. There's something about being authentic that's like very much with this younger generation. And it's very interesting because in the past, people would have these really like scooped, ridiculous, almost
Totally.
very done looking noses, but also oh, I didn't do anything. I don't want anyone to know that I did
Yeah,
anything.
Or they'd go into
They
hiding
go
for
away
like,
and then they
you
come
know,
back
yeah.
and they look
And it's
completely
like,
different.
well,
Yeah,
that
yeah, yeah.
seems like it could be a little noticeable. Whereas now it's like we're doing almost imperceptible, very subtle, tasteful changes that
Totally.
no one would really clock. But they are like, I'm open about it. And I'm like, okay, yeah, use my photos. I'm happy to talk about it with anyone.
Yeah.
And
Yeah.
it's interesting. I think it's the internet, and everyone has to just being more transparent because it's going to come out anyway. Like,
Right.
Exactly. And there's a lot more photos of you in perpetuity on the internet to like you could find yourself 20 years ago or now.
I also think people want to know, they want to go to a good doctor. You know, it was thinking about your practice, and what kind of stands out to me is that, you know, you do these non-invasive cosmetic procedures, but you also have the ability to do the surgeries and to, you know, or even a combination of both. And I
Yeah.
think people talk
lot
about it more
less.
because they want to know, well, who should I see? Who should I go
Yeah.
to?
yeah.
You know,
Yeah.
Yeah, totally. And with something like even the tip stitch rhinoplasty, like I'll do that away. And the irony is I have a full certified operating room in my office. So it would be very easy for me to schedule someone in the operating room without, much problem. But yeah, it's not for everyone. So if I do the smaller thing first, if that's not enough or you are ready to go for the bigger thing, I can offer that as well, which is, I think, a very nice thing. And that's better than, especially with the nose, things like fillers in the nose, which could be actually quite dangerous and can damage the skin permanently, and they don't last. Or thread lifts, which I think I've seen people from California get them, but not so much in New York. They don't last. There's risks with them. Having the ability to offer something semi-surgical and then fully surgical if needed is totally important.
I mean, we joke a lot on our podcast about how Jen does, and you met us in person, and Jen does everything, and I do nothing. So
I
if
mean, I don't
someone,
do everything. Let's
You-
say, like,
you
I will
would do
try anything. I would
everything
try
if
Oh,
anything.
you're
you
there
could.
to chronicle the journey and see
I would
what
try.
Totally.
Yeah,
the
she was.
objective
Totally.
third party
She
that
was
says,
right.
Exactly. And so, but someone comes in, like, here's something like I never have thought about doing, and someone comes in, is it better to start on a face that has nothing done, like mine, or has had things done? Like, is there like if all of a sudden I decided, well, it's funny. I
Blank
mean, you
slate.
mentioned these GLP-1 drugs, and I'm on one, and I have noticed I mean, you probably can notice them too, actually, but I've noticed that I have jowls for the first time in my life. And so it's the first time like I ever thought like, oh, I'm starting to look old. Like the fat that I had protected me from looking as old as I am. And now all of a sudden I feel like I'm starting to look my age, which has always been, my superpower is I don't look my age.
yeah.
And so is that better to come in as a clean slate?
I think it's not necessarily, but it depends on what you're having done. And if you go to like several different doctors from different specialties, they'll offer you different things in a different order, and it can be very difficult to decipher and coordinate what you should have done. In general, it doesn't necessarily make a huge difference unless what you're having done isn't really reversible. So, for example, if you go and you're like, I have some jowls, someone recommended putting some filler over here to hide it, right? You can do that. I've done it. I do it for some patients. It's not the best treatment. It's okay. If you have it done and it's dissolvable fillers, we can dissolve that. That's not a problem. If you go, however, and do like a thread lift with like permanent threads, which then cause scarring and potential infection issues, that's a lot harder to reverse and to deal with. Or if you have energy-based devices that are really heating the area and causing it's some tightening, but it comes at the price of losing a little more volume or a little internal scarring, it can make going in for surgery more difficult. It's almost like doing a revision surgery because everything has healed and the collagen is scarring, essentially.
Yeah.
It's a
Yeah.
fun way of saying
Right. Yeah.
scarring. These things promote collagen by semi-injuring the skin and soft tissue, and then the body heals thicker and stronger. And that thicker, stronger skin can be tighter and more attached. Instead of everything peeling and separating off nicely in surgery, it makes it a little more difficult to do. So you have to be very honest with yourself about, is surgery potentially an option? Because if it is, then you might want to at least get a consultation and explore what that is before committing to these other things that can make the surgery more difficult or even more expensive in certain ways because it's almost like a revision. So sometimes people charge more. At least know what you're getting into so that you can kind of plan which one.
I feel like you go right for the surgery.
Yeah.
You don't
Well,
mess
it
around.
has been
You just
suggested
do
to
it.
me by my dermatologist to have my eyelids done.
Yeah. So
Um,
eyelids of all things are like one of the highest satisfaction, especially the upper eyelids, because it's very straightforward. It could even be done awake if there's not a lot of fat that needs to be addressed. You just kind of pinch the skin and remove it and it's gone. And it can even be, like I said, awake. So you're there for the whole thing. The recovery is pretty quick and you're not transforming someone too much. Now, if you overly take out too much fat and hollow someone, or if someone always had like a fuller brow area and you reverse that and they look different story. They're not going to be happy unless they hated it.
yeah.
Right. So that's interesting because we have very different, like your eyelids, you have big eyes and so do I, but in a different way. Like mine are deep set and yours, I could see like why if you like,
I'll take my glasses off.
well,
but
doesn't
yeah,
it happen where like it
yeah.
sometimes will impair your vision, right? Like the eyelid
Yeah,
will
like
come
the
over.
eyelid becomes like
Over
at
your
some
eye.
point it does, and there is some component of if the eyelid is blocking your vision, you could do visual field testing and insurance can get involved, although they almost always give it a hard time or reject it. And essentially, yes, the brow gets heavy and that brings with it the eyelid. And if it's to the point where it's like pushing on your eyelashes, then you'll have a hard time seeing the full field of vision, especially higher up, or you'll feel tired and difficult to see out of your eyes even towards the end of the day when the muscles are tired from lifting.
Interesting. So then, all right. So then with someone like me, I'm gonna take my glasses off now too. So I always wanted to get my eyes done because I have so much eyelid. Like you could see so much of my eyelid and I always hated that. Like there's a lot of loose skin here. Like what would you do for that?
So like an unknown or a lesser known treatment for eyelids is traditionally it was always, let's take the fat out, let's take all the skin, and everyone kind of like beat their chest on how much fat they took out. And then, years later it would cause hollowing and it would look have a cadaveric look and it would be very aging. And you don't lose fat around the eye socket until like your 80s and 90s. So that can make someone look very old if it's overdone. Now the blepharoplasty surgeries are aimed at preserving the fat or transposing the fat, especially on the lower lid. Instead of taking all the fat out, I'll reposition it or move it to a slightly different area where is hollow and it fills in the hollow nicely and we don't have to take all the fat out. For the upper eyelid, you can actually put some volume in there with fillers, and someone who has a hollow eyelid, whether it be from previous surgery where they took too much fat or just the natural anatomy, putting in some filler over here in someone who has like a very deep set eye or like you can see almost the ledge of the eye socket, it will use up some of that loose skin. Basically, if you think of like a raisin going to a grape type of thing, a lot of that loose skin is because there's not enough volume. And if you actually put some volume in over there, it softens the appearance of that bony ledge and it can fill some of that extra skin without actually having to remove it. A mistake would be to keep removing the skin, whereas it's just going to look more hollow sometimes.
Oh, all right. Can we do that next time I come in?
I was going to say, we have really turned this interview into a consultation session. I don't know that you realize that.
With anyone now.
Look,
it's the same in my field. Every time I meet somebody, they ask me nutrition questions and they ask me.
That's true.
Oh, yeah.
But I would, I never heard of doing that. So putting filler.
I mean, it's hard to see with like these little cameras, but in person, but sometimes
they're very deep.
It's one of like it's a very like niche thing, but it's very nice in the right person, and it's done with a cannula, just kind of right on the side of the eyelid, and you don't need a lot of product, and it really just softens the whole the orbit essentially.
I'm totally doing it.
Socket.
I'm totally doing it.
I love it. Yes.
Okay. So what is your opinion on all therapy?
So I've trained on all therapy and I've used it, and there's like a newer iteration of it now called soft wave, which is a little bit less intense, but it's basically focused ultrasound that is heating subcutaneous tissue so the heat induces some collagen formation and some just tightening. The results from therapy were, again, as a surgeon, never really overwhelming. They're okay. And you can potentially cause damage with Ulthera if you're not careful and you zap an area where there's like a nerve that moves your face, because those nerves can be pretty superficial and close to the skin. So there was some risk to it. It was a little painful. Soft wave solved some of that, I think. I don't have a soft wave, so I can't like talk too much about it, but it's the same idea of using ultrasound to heat and contract tissue. It's maybe good. I think it's better for like a maintenance therapy versus if you already have loose skin that you're able to pinch and move, it's not going to tighten that dramatically. You might be better off doing the facelift and then, we continue to age, treating it again with something that's non-invasive to maintain the result.
Wow.
Okay. Well, I've had both therapy and soft wave.
Oh, okay,
and
great.
I
So
can
you
tell
me
you,
yours,
then.
well, I can tell you. So I did therapy for just the top half of my face.
Mhm.
It was
It's painful.
extremely painful.
Yeah, it hurts.
Extremely painful. I mean, I had to keep stopping her.
Yeah.
I'm like, I can't take it anymore.
It takes a
But-
long time to do too. It's painful for the
Yes.
operator because
Or
you're
a
holding
l-
this thing like your shoulder starts hurting after.
It was like an hour, I
Yeah.
think.
yeah.
But the soft wave, I had it done on my chest, on like the line, those vertical lines that in the décolleté area, and it was less painful. It was quicker, first of all, much quicker and less painful. And I really feel like I got a good result. I mean, I would probably do it again, just to get even more. Like a lot of those like brown spots, sunspots and stuff. It kind of addressed those. But I just wasn't sure if they're similar then.
It's I think all therapy works a little deeper. The soft wave might be better for like crepey, like more superficial wrinkles. And then something like surgical, it's going to be more for like folds, like the actual skin is loose enough where it's folding on itself. And then you want to like actually pull the rug back and
Yeah.
Right.
take everything else with it.
I need a little rug pulling.
Yeah.
Yeah.
I think right here.
Do you?
So there used to be, I don't know if they still do this. There used to be the injections that you would put.
The Kybella to melt the
Kybella.
fat. Yeah.
Yes. Is that still a thing?
I don't know anyone who uses that anymore. But here's the, and again, it was like when I was in fellowship, it was like the hot new thing that had just come out and you don't need to have surgery. So you would basically, what it is it's a chemical detergent essentially. What it does is just breaks up the fat cells. So it melts the fat by disrupting the fat cells with an injection. Usually you would need like 2 or 3 treatments and you're like, oh, it's great. You don't have to do liposuction. But every time you do the treatment, it caused so much redness and swelling. You almost look like a bullfrog for 5 days.
Oh,
So
wow.
you can't, it's not like you have no downtime. You're just not really going anywhere for that time. So it's wasn't really saving you anything. And then something like liposuction on the chin, you could do that awake. If it's very localized, you just numb the area. There's a loud sound with like the vacuuming, but besides that, it's very tolerable and it comes out in one shot. And, you wear like a little compression dressing for a little bit and the result's permanent. The fat's out of there. You don't have to come back and do it again and again and
Right.
all
Wow.
of that.
All right.
It also,
That's
the Kybella
another
would
thing.
melt here's the fun fact is our nerves are surrounded by fat and that's what helps them conduct electricity. And so in this area, you have facial nerves that move your lips. And if you move the injection a little too close to that area and it hit and melted the fat around that nerve, you can lose function of that nerve. So people had potentially nerve palsies with it where their lip would move funny. Sometimes it would be temporary, but again, why take that risk with something? I mean, if it's not doing such a great job anyway.
Yeah, if you don't have to. All right, so I'm coming in for the filler in my eyes, and I'm coming in for maybe a little bit of this.
Okay.
I think people need to know, what, and also like, do you do the non-invasive stuff versus just cut to the chase and do,
do the whole thing.
do the whole thing,
Yeah.
or I don't know, because I think like over time, if it's a financial thing, you're spending so much money
Over
I mean, I
time.
started getting Botox, I think when I was 35,
Wow.
34, or something
Yeah.
like that. That's a long time. It's 20
I mean,
years.
it can add up. Yeah, for sure.
Yeah.
Yeah, of getting all of these. I mean, look, I love it. I love all of it.
You sure do.
Just your skin health is so important. I mean, I used to be a sun worshiper.
Yeah, you've
And
stopped completely.
some of the doctors we've talked to on this podcast, dermatologists and things,
Yeah.
and I also had CO2 laser done last year. And she said to me, if you go in the sun, you're just gonna ruin this. It's like you never did it. And I have not been in the sun for probably, I mean, I know this isn't like a long time, but 2 summers. I have been like big hats, sunscreen, like really, really, really
I have to
protecting
say,
my
your
face.
skin does look fantastic.
My skin looks pretty good.
Yeah,
looks
no,
pretty good.
when you had that done, that I was like, it's the first time I ever considered doing something because her skin, I mean, she looked like a child. Like,
But I
it was
also-
like that. It really.
that
Yeah.
downtime is not fun though either.
No,
You're very red for a
you're
long
very
time.
red. Yeah.
Except for the fact that my mom said to me recently, "You look so pale. Are you okay? You look so
I mean,
pale."
look, some sun is good, and
Yeah.
like you don't want to be like socially reclusive because you're terrified of
know.
being in the sun even for a minute.
Right.
Right.
All of
Right.
these things have like moderation, and
Right.
Yeah.
some
No,
sunlight is actually
Right.
good, and it's helpful
Yeah.
for some skin.
Yeah.
conditions. So
I'll let my body get, some sun,
Right.
and I'm very
Good,
active
yeah.
outside and things like that.
I had someone a patient once who he had the nicest skin I've ever seen, and he was working like he was like a train operator but worked the night shift, so he like hadn't seen the sun in like 20, 30 years, and it was just like the smoothest, most baby-like skin ever. So there is truth to this, and in certain cultures, like in Korean cultures, I think it's like the sun is not, like, people want to stay out of the sun in some of those
Yeah.
cultures, so
Oh, yeah.
it could be partially why their skin is so great.
Yeah. All right. So looking ahead, what do you see? What do you anticipate? What do you anticipate that you do now that's going to be like an everyday thing? Like people are just going to do that. And also, what do you anticipate that's going to be like coming technology, which will make what you do now easier, or maybe
Better
something completely
results.
new?
Yeah.
And better results for your patient.
Coming technology results. It's a very good question. I think it seems like almost every like 6 months or a year, there's like new technology coming out. So I'm a little bit old fashioned, and I think the stuff that's been around and has been working is like the best. So surgical results, I think, they're gonna stay there now. Are there things that are gonna make surgical results better? Yeah, I think there's going to be maybe some things to help with recovery, like different devices like LED masks are being used now, and that could be helpful for recovery. Hyperbaric oxygen is being used, and that's more common now. It's helpful for recovery. Other technology, I mean, we're living in an AI world. Is that changing what we're doing? There's a lot of studies on how useful AI is for preparing patients for surgery, answering questions, and also answering questions about recovery. So can it streamline and answer things that we may sometimes forget to tell patients, I suppose? Yeah. And
Wow.
maybe it'll help make sense of all the different options for everyone. But for right now, it is useful for like question answer stuff, definitely. I don't have like a magic gun thing that's gonna like revolutionize what we're doing. Everything is really just kind of assisting what the surgeons are doing. I use a lot of photography, and I use Photoshop to kind of simulate things for patients to see what their nose would look like, for example, before actually doing a surgery. And there's new 3D cameras that are out that you can do it in a 3D model, and there's even printed models where you can get like a simulation of your own head, and like this is what your whole head would look like with this rhinoplasty. It's fun. It's interesting. Is it changing what we're doing exactly? Not particularly. And the next iteration is there's also molds that are being made based on those 3D images where you can snap it onto the person's nose intra-op, so like during surgery, to get that perfect, like what we discussed thing. I think, again, I sound like an old person who just loves the traditional thing. I don't think they're as useful as experience and having done it, because that's the ultimate. Are they fun? Are they useful for explaining results to patients and how things work? Definitely. And I think that's really important. That's very good.
Yeah, I think too, like that, like you said, a lot of new things are always coming out, new technology and different treatment options and all of that. But have they really been researched in real time on patients, and
Right.
how did they work? And I know I've been to doctors who have said, I've asked for something and they said that's too new. I won't do that. I don't really know
Yeah.
enough about it, So
Right.
I think that's probably the case too. I like the old school traditional,
Yeah.
I'm up for that.
You definitely
But
are.
I do just want to say, I just want to clarify, because now I'm a little feeling like I'm a little vain here. I want to say that.
Yeah, I can't wait to hear what you're gonna say. But go on.
I'm a little frightened.
I think that there's a place for these things. This is not for
Yes.
everyone.
No.
This is definitely, obviously, I mean, you don't do any of this stuff and you're perfectly happy.
Yes.
I would not be happy if I didn't have these options. I
Yes,
think.
but you don't know that you wouldn't be happy if you had done nothing.
Oh,
If
I
you
know.
had-
No, I know I wouldn't be. I mean, as soon as I started seeing the first signs, I was like, I need Botox. So I know that I wasn't happy.
Well, I do have a regret about Botox. I mean, now I never. Oh my God, I'm all tangled up. I do have a regret when it comes to Botox in that I didn't do it, and now I'm at a point where I think it's too late. Like the lines are too deep. Like that. That's why the dermatologist had suggested the eye lift, because this is not really fixable. But now I'm seeing it. Now I'm in my 60s and I'm seeing it, and now I'm like, oh, why didn't I listen to anyone when I was 40?
Yeah, no, totally. When I first started, there was all this like, oh, preventative Botox, and I was like, oh, that sounds like a gimmick and all of that. And I had a few patients who had, for medical reasons, half of their forehead not moving, was paralyzed. And I'm looking at their foreheads, and I have like photos of all these people. It's like deep creases, and then smooth as can be on the side that wasn't moving for the last 10 years. So there is definitely some preventative aspect. If you're not physically moving these muscles and creasing the skin, you'll prevent the deep etching that can happen over time.
Yeah, I
that's true.
just, I just wanted to say it. It
And
is
look, I just
not for
admitted that I
everyone,
had
and
regrets.
You have regrets. See,
Yeah.
I don't have regrets.
Yeah.
I mean, I was the opposite, where people told me like, "Why are you doing that? Stop
Yeah,
doing that. You don't
yeah.
need to do it." And I'm like, "No,
No,
you
but I
don't
know
know
that
that I
I'm
don't
doing
need
a lot
to do
of
it."
There's a lot of shaming in the internet
Yes.
and
I
such,
agree with
especially.
that.
Totally.
Yes,
Like
that's
we
a shame.
had some articles come out about this tip stitch rhinoplasty, and it like, I know that people like enjoyed it because we got a lot of inquiries and phone calls and such. But then if you go and you read the comments, they're just some of the most vile, aggressive, like, and and it doesn't even make sense. It's like, it doesn't even coincide with what we were doing or talking about in the article. So to each their own, and whatever makes somebody happy, as long,
I agree.
if someone else wants to do something and
Right.
you're not harming them physically in the process, and it's making them feel better and like live their life in the fullest way that they can, why not?
Yeah,
Yeah, I agree
absolutely.
with
I
that.
think that the judgment
Yeah.
for some of these things is so ridiculous, especially, if you post something on social media, or you, even an article
Right.
like you just mentioned, and people come on and they comment, and all these negative comments. Why are you even following that person if you're going
I
to
know.
Right,
if you're gonna
exactly.
go
be-
on and say something that's
That's
negative?
the same with anything.
It's
That's the same with anything.
ridiculous to
I
me. It's
agree.
like,
I
don't
agree.
follow that. If you're not
Yeah.
interested in having whatever
Yeah.
the procedure is, then get off that person's profile.
And it's also, but I mean, it's also a minority. It's the
Yeah.
silent people that aren't saying anything, that are actually, they're interested. They want to have more
Yeah.
information, and
Sure.
having like good information at their disposal, I think, is helpful. And
Yeah.
you need
Yeah.
to like talk to a few people. And I tell all patients, if something someone's selling you doesn't make sense, like,
Then it
at
doesn't make
least
sense.
like think about it and go get another
Yeah.
opinion, because it all has to make sense. If someone's just kind of saying something and you're like, I don't know about that, and
Yeah.
it's just
Yeah.
like Instagram credentials, and
100%.
I don't know, I'm on Instagram too, so I don't know what to say, but like,
Yeah,
there
yeah.
are
but
people who
no,
don't have any
that's-
qualifications that are on
Exactly.
there.
And they're
Exactly.
totally.
Yeah, I
totally.
think that, and that's part of why, we're having you on and having this conversation today, is to just get that information,
Yeah.
and people can make the decisions for themselves. I'm not sitting here
absolutely.
saying everyone should go and have a facelift.
Yeah.
Yeah, no, definitely not. It's just for whoever is looking for it.
Yeah.
Yeah.
All right.
Anyway.
Well, thank you so much for this.
My pleasure.
This is
It's fun.
great.
Yes,
lot of fun.
thank you so much for
Yeah,
being
yeah.
here. We really appreciate it. And Yeah, I guess that's it. Is there somewhere that people just can look you up and
Yes.
or where are you on Instagram?
On social media, it's at Dr. MBT. So doctor spelled out, DOCTOR MBT, and Dr. MBT is our website. So we have a lot of before and afters and such there. And
Great.
we're on the Upper East Side. So if anyone wants to come in, we're more than happy to see them.
I'll be there.
Well, General, thanks for being here, Dr. Bassiri.
Thank you.
All right. Thank you again.
So
still laughing at me.
I'm laughing at you because you literally just said to me, I look so tired, even more tired after talking to him.
Yeah, I really
was like,
do.
What?
I really do. I am definitely going to go see him.
Yes, you are. We started with asking him questions, and then we continued by asking him very specific questions related to
For a
each
friend.
of us.
Asking for a friend.
For very yes.
But I mean, he gave great answers. I think
so too.
There is a balance. Some people are totally fine with doing nothing.
Yeah.
And like, I hate when people say like, oh, don't you want to age gracefully? Well, to me,
this is aging gracefully.
That's how I'm choosing to do it. I don't, but I think it's fine if you choose to do nothing. Absolutely.
I know.
I mean, most of my friends, I would say, don't do anything.
Yeah.
Or they do, very little.
Yeah.
But no, he was great.
Most of your friends do very little.
Yeah.
Really?
Mm-hmm. I would say my 3 best friends have never done anything.
Really?
Mm-hmm.
Wow.
Yep.
Your 4 best friends.
My 4 best friends have never done anything.
Apparently, I've been relegated to not being a best friend.
But you know what I mean? My group
I know
of
you're talking about
girls.
I know that they supersede me.
They've never done anything.
That's
And
interesting.
they look great.
Even the one?
None of them have ever done anything.
Wow.
Mm-mm. I mean, one of them has tried once Botox, and she hated it. She had a bad
that
reaction.
was me. I didn't like it either, but
Yeah.
I do regret not continuing it. I would say, well, look, I have one friend who's an ex-dermatologist, so she's definitely is all on board.
She's on board with it.
And the others, I would say a lot of my friends, I mean, look, at work, I would say 80% of the people do Botox.
Mm-hmm.
I mean,
Sure. Yeah.
but there's definitely people who do nothing.
Yeah.
Yeah.
So,
But
to each their own.
to each their own. It's like a good give and take of it.
Mhm.
I just think it's funny that you I do wonder what you would look like if you had done nothing.
Yeah. I mean,
You don't ever wonder that. You wonder about it in fear.
in fear.
In fear.
In like
Yeah.
very much fear. No, I think that like,
No.
look, I've never done anything invasive. I've never done a facelift.
Yeah,
I've never
that
done.
kind of thing. You know what keeps me from doing it?
Oh, sorry.
You know what keeps me from doing it is the fear that I would look in the mirror and not recognize
Well,
who
that's
is
just
looking
that's
back.
just it.
And I
Like,
think that keeps me from doing it.
Yeah.
Although I know so many people who do things, you for one,
Mhm.
and it's
You don't look any
have a face-
different.
you don't really look any different with the things that you do.
right.
And so that changes my mind. But even knowing some people and like many celebrities that come on the
Yeah,
show.
and they're overdone.
And but there's some celebrities who look like they've had nothing done and they've had everything
and that's the
done.
way to do it.
And that's the way to do it.
Is those
Yeah.
like he was saying, just enhancing what you
Right.
already have instead
Right.
of changing your appearance. Like people that come in and say, "I
Right.
want this nose." Well, guess what? That nose is not going to look right
Good
on
on
you.
your face.
Yeah, on your face.
Wow.
So, but yeah,
anyway.
it was great.
A lot of food for thought. We hope it got you thinking a little bit.
And don't judge me.
Apparently, someone is very afraid of being judged.
Always.
About to sign off.
Always.
Don't judge me.
Always.
Don't judge me. No. But anyway, I'm Lori Schulweiss.
And
You
I'm
can
Jen
think what
Giammo.
you like. And this was Everybody Talks.
For more information about our podcast, to learn more about us, or to catch up on all of our episodes, go to our website at everybodytalkspodcast.com.
Follow us on Instagram at Shirley, at Jen Giammo, and at Everybody Talks. And if you want to watch today's episode, go to our YouTube channel at Everybody Talks Podcast.
If you want to be a part of the conversation, join the Everybody Talks community and become an exclusive member of our wellness group. Check out the link in our show notes to learn more.
Don't forget, if you like what you've heard, give us a 5-star rating, write a review, and tell a friend. We're for everybody and everybody. The Everybody Talks podcast is co-created, executive produced, and hosted by
us, Lori Schulweiss and Jen Giamo. Produced and edited by Station 16.
Our theme song music is written and performed by Jackie Ryle and Aaron Navisi, with additional support from our pups, Oliver, Milo, Murray, and Frankie.
Talk to you next time.